Assalamu alaikum, this is Tarig Muhammad. Inshallah, we'll discuss one of the internal medicine topics called peripheral artery disease. This condition recently discussed and updated by European Society of Cardiology in 2024. Peripheral vascular disease or peripheral artery disease is chronic vaso-occlusive disease of the peripheral arteries, usually due to atherosclerosis. Mainly arterial atherosclerosis and affect commonly the legs. أكتر شيء peripheral artery disease affect the legs than arms. طيب, the patient commonly present with calf pain, upper calf pain or lower calf pain. Patient will present with calf pain. إذا كان upper calf pain, this may be due to occlusion of superficial femoral artery. إذا كان upper calf usually suggests occlusion of superficial femoral artery. Right. Also present with buttock and hip pain in iliac or common femoral artery occlusion. You can present with hip or buttock pain. طيب, واحدة من السيمتومز الأعيان ممكن يجيبها عبارة عن ischemic pain in the lower limbs with walking, call it claudication. واحدة من ال other findings هي الكلوديكيشن. طيب, claudication عبارة عن ischemic limb pain with walking relieved by rest. This ischemic limb pain with walking relieved by rest. طيب, the classification of peripheral artery disease can be classified. أول حاجة البيشنت ممكن يكون asymptomatic. Classification, patient may be asymptomatic. Our patient has intermittent claudication. This intermittent claudication result in stopping of walking. إذا كان البيشنت stop walking for distance more than 200 meter, this grade 2A. إذا كان less than 200 meter, this is grade 2B. Stage 3, the patient may have rest or nocturnal pain. Rest or nocturnal pain. And stage 4, last stage, patient present with necrosis, gangrene. Necrosis or gangrene. They are stages of limb ischemia due to peripheral artery disease. في الستيج الأخير عبارة عن critical stage or critical limb ischemia. Patient present with pain mainly in toes, usually at night, associated with pulseless, cold peripheries, cold and pale peripheries. ممكن يكون في red and swelling إذا كان في release intracellular substance. طيب differential diagnosis for patient with intermittent claudication. differential واحد ممكن يكون disc degeneration or spinal stenosis. Also diabetic neuropathy. These are the differential diagnoses: disc degeneration, spinal stenosis, and diabetic neuropathy. Patient can be investigated with some investigations. For all patients, do random blood glucose, lipid profile, serum creatinine, do liver function, also complete blood count, ASR, and ECG for all patients. Imaging like MRA, CT, angiography also may need it. One of the important tests that can be done is ankle brachial index, measuring systolic blood pressure in the ankle and divided by the systolic blood pressure in the brachial. Usually measured the left arm and the left leg. Check the dorsalis pedis and posterior tibial, also posterior tibial artery. Also the patient can be assessed with Doppler ultrasound during ankle brachial index measurement. A normal ankle brachial index between 1 to 1.3. Normally there is higher systolic blood pressure in the lower limb, so the normal range between 1 to 1.3. If it is 9 or lower, patient may have peripheral artery disease. If it is more than 0.3, this may suggest arteriolosclerosis or calcification. This is ultrasound device checking the posterior tibial, it is dorsalis pedis and posterior tibial artery, also the brachial artery. Here the ankle brachial index, normal range between 1 to 1.3, more than 1.4 suggests arteriolosclerosis or calcification, less than 0.9 suggests and peripheral artery disease. Patient should be in supine position, resting 5 to 10 minutes in constant room temperature. Peripheral artery disease can also be categorized according to the clinical presentation. Hello patient, asymptomatic, this is grade 0, symptomatic peripheral artery disease 1, 2, 3, chronic limb ischemia or threatening ischemia 4, 5, and 6. According to the symptoms, asymptomatic, mild claudication, intermittent or severe claudication, ischemic rest pain, minor tissue loss, major tissue loss. And here the stages: stage 1, 2A, 2B, stage 3, and stage 4. Look for the underlying risk factors for development of peripheral artery disease. Modifiable risk factors like tobacco, smoking, diabetes, hyperlipidemia, hypertension, these are modifiable risk factors. Non-modifiable like age, male gender, and family inheritance. Female factors like pregnancy-induced hyperlipidemia, hypertension and diabetes, also menopause. Others non-traditional risk factors like overweight and obesity, sedentary lifestyle, sleep disturbance, stressful lifestyle, alcohol, diet, inflammation including infection, proteins, autoimmune diseases, environmental pollution, and socioeconomic status. Then come to the treatment. Patient should have optimal medical treatment, address the general cardiovascular risk prevention, address lower limb related symptoms and improve quality of life, give antihypertensive, cholesterol lowering drugs, optimal glucose control in diabetics, antithrombotics for some patients, exercise training, weight loss, healthy diet, and stop smoking. And lastly, revascularization. The كان البيشنت symptomatic or present with limb ischemia. If asymptomatic, just medical treatment, no revascularization. This is a brief talk about peripheral artery disease, topic discussed by European Society of Cardiology in 2024.